We're joined by medical expert Dr Aslam Dasoo and health journalist Laura Lopez Gonzalez. To both of our guests, thank you so much for your time. Dr Dasoo, I want to begin with you this morning because I suppose there are big questions now about whether the state of disaster served us in the way that it was initially intended to, in terms of managing COVID-19.
Good morning, Michelle, and to Laura and to your viewers. Look, I think this is going to be a long conversation, whether the state of disaster and the response of the government and of the country as a whole was adequate. At the moment, I mean, I think just listening to the president yesterday with all the changes to the laws and so on, I mean, you know, that's all just regulatory theater and state admin. The fact of the matter is that we are no longer in a state of disaster, which is a good thing from a democratic point of view. At least we now have parliamentary oversight over the actions of the executive, which has been a real problem these last 2 years. You know, for the government, an honest appraisal would reveal its many shortcomings in both the response as well as, you know, having a weak and fairly incapable and unwieldy state. We saw how this was actually played out, how all this played out at various levels of this of the lockdowns and in terms of all the surges we had. For the people, you know, the stakes are much higher actually. So what have we learned? First, everyone's understanding of biology has improved, especially for politicians, you know, who generally have poor facility with it, and we saw how they reacted to what should have been a scientific response in ways that had no bearing on the science. Second, the majority of the population, I guess, believes that there are measures that can protect them, even if they're not diligent in observing these measures. So that's just a plus. I think there has been a step change in how society responds to these things. Yeah. And then third is that we know for an incontrovertible fact now that vaccination prevents the progress of COVID-19 to severe disease, hospitalization, and death. I mean, close to 90% of all admissions to hospital has been among the unvaccinated. So that provides a very strong incentive to get everyone vaccinated. And lastly, you know, the impact on the economy, on mental health, especially of the under 35s, has been quite significant. And I think we've got a lot of work to do in getting our next generation to overcome these 2 years of great sensory deprivation and loss of focus in their prospects and so on. Schools are back, we are very fortunate to say. And after 2 million people lost their jobs, I think it's a less rosy outlook than what the president, and I think justifiably, tried to stir us all up on, given that the state of disaster is now over.
Yeah, certainly.
So I think we need to rethink what also our health system is capable of. It was seriously stressed and didn't do too well.
Yeah. Laura, I want to bring you into the conversation there because I want to just pick up on some of the points Dr. Dasoo had to make in terms of the impact on the economy and the loss of jobs during the period under the national state of disaster. In fact, many civil society organizations will argue that the decision announced by the president last night is maybe 6 months too late. Is that something that you would agree with?
Yeah, I think it's so difficult to say. I think, but this point that you bring up is so crucial about the job losses. And certainly what we saw with the Newzroom data is this sudden sort of rise in hunger. We saw a little bit of a clawback from those levels of hunger, but still at the sort of end of last year, hunger had really stabilized at what I think some researchers had called sort of a new kind of threshold, right? And we saw certainly that those job losses were not equally felt throughout the country. Black women, of course, low-paid Black women feeling them the hardest. Those, of course, are sort of heads of households, and serious issues for health and nutrition on that front. We also know that in some of the reckoning that Dr. Dasoo has sort of talked about and what did and didn't work, the Department of Social Development kind of saying, listen, that 350 Rand grant that many people are very happy that it's continuing, did not reach women in the same numbers as it reached men because they were eliminated by them receiving a child grant. So I think we're going to keep seeing this reckoning of what we did wrong, what we didn't do right, what we did right as a country, rather. It's difficult to say. I think what you really saw government saying over and over again, especially in the last month, is the big barrier to lifting the state of disaster earlier was the fact that they didn't have these regulatory kind of provisions that you're seeing being adapted into or being proposed into law right now. And that was really their repeated kind of concern about lifting this sooner.
The other issue, Laura, is Dr. Dasoo just mentioned the impact on our healthcare system and the holes that were identified under the COVID-19 period. There are other social issues that have escalated as well over the past 2 years. Just some of the front pages this morning in the newspapers, more babies abandoned during this 2-year period. As you also just mentioned, hunger on the rise, particularly among children, and of course our unemployment numbers. These are all issues that we now have to reckon with post the national state of disaster.
Definitely, and I think it's so interesting too, because I think as a nation, we were able to make gains in ways that we were told we wouldn't be able to do very quickly through COVID. So for instance, we were able to find new ways to deliver ARVs that we were told we'd have to wait for government. We were able to give water to communities that hadn't gotten water, for instance. But it did reveal all these cracks, as it did throughout the world, in this inequality, in our sort of these systemic issues. And it's really been a barrier for the vaccine campaign. So if you go out and you talk to young people who, that 18 to 35 age group is still quite lagging behind in their vaccination rates. And some interesting things that I spoke to, some of the people working on creating that demand. And, for a young person who is facing unemployment, chronic unemployment, and has been for years, their more immediate threat sometimes is felt not to be COVID, but more, what am I doing today to put food on the table? So I think we have to start confronting these systemic things that were really just brought to the fore through COVID.
Yeah. And is that a good thing, Dr. Dasoo, particularly when it comes to the healthcare system? Just over the past couple of weeks, we've seen numerous reports, particularly in terms of Gauteng health and where those big holes are in terms of the administration of the health sector here in the province. I mean, it's a good thing long term, isn't it, that we see where these gaps are?
Sure. And that's what pandemics do. They reveal the inadequacies in society, the big holes, as you put it, the fractures in society, and amplify very often the existing trends. So in the health system, which was already beleaguered before the pandemic arose, a sudden hit like this, I think just made it crack. And that's really on the government. The public health system in particular, which takes care of over 80% of the population, was just not up to speed. It was the health workers who went above and beyond the call of duty in the most trying circumstances, putting their own lives on the line, who got us through this. So I think it must have been appreciated by health workers that the president acknowledged their response in this. This state of disaster under the Disaster Management Act, which is an act meant to deal with acute disasters, natural or unnatural, with national consequence. It wasn't meant to be a tool to manage a multi-year pandemic, which is how the government used it. And unfortunately created a lot more damage than was necessary. However, we can look back and say looking back is 2020 vision, but the fact of the matter is if we don't learn from this, the next pandemic is going to hit us even harder. And unless we accept that we have a duty now to review what we have done through an independent inquiry, go through all of these issues, what did we do right, what did we do wrong, and do so honestly, we won't have learned much. I think that the health system, as you mentioned, in Gauteng, is an utter disaster, and those in charge of it either should step aside because they're just not up to it, or another plan needs to be made. The status quo is not acceptable. And really, the pandemic has revealed this in ways that no one else could or nothing else could. And so, when we reflect, and it is really a time to reflect now, South Africans have made their way through this. There's going to be some with abiding loss out of this pandemic. Others will have learned and have made a new way of doing things. And I think all of these things will come together if reflection is honest and if it's open and impartial. You know, we can't be guided by state propaganda that, look, we did everything correctly. They know they didn't, you know, and it's just no point in telling the people that we did. It's time for the honesty. I think the president has that within him. Whether his government has that is another question.
Another inquiry to check whether it was indeed a successful use of the national state of disaster. I think it's the one time we might all agree that an inquiry is necessary. Let me